Hello, good evening, and welcome back. It is always nice when a libertarian think tank actually makes waves. It's nice that those positions are still being made and listened to, even if they are largely rebutted instead of refuted. But nonetheless, it's good to get the message out, and it gets more eyes on the content, which is exactly what we're doing today. As the NHS has been, quote, nothing special during the pandemic, says free market think tank, which claims it does not deserve adulation, as it has not helped Britain cope any better with coronavirus than any other countries. So the Institute for Economic Affairs said there was no rational basis for adulation NHS received during crisis, said nations that cope best with COVID often had no public health services, and also attacked right-wingers for saying UK should be more self-sufficient. So, when he's saying that the nations cope best with COVID often and no public health services, the actual point of the paper was not that at all. The point was just to avoid confirmation bias. That was the entire point of his paper. And to take it straight from the horse's mouth, let's deal with a false COVID-19 narrative in a moment. But first, how he himself, the German doctor, claims for the purpose of his paper is that the claim of this paper is that a sensible pandemic response is compatible with a variety of public spending levels, a variety of trading arrangements, and a variety of healthcare systems. Put differently, the claim of this paper is that a pandemic is not going to solve our long-standing ideological disputes for us. Age-old arguments about the appropriate balance between the state and the market, about how open our economy should be, or about what type of health reforms, if any, we need, are not going to be settled by a virus. Those who want to make the case that we should raise public spending, deglobalize the economy, or hold on to our current healthcare system should make that case on its own merits, not by presenting it as the lesson we should supposedly learn from COVID-19. Because, although they like to say, he's saying that countries with lower health spending did better, well, he does actually say that, yes, his own leanings for a liberal free market economist, like the author of the paper, to claim that liberal, relatively free market economy is the best place to deal with a pandemic, but, as it is not the claim of the paper, because you can find counter-narratives, like the Socialist Republic of Vietnam, a self-described Marxist-Leninist state under the rule of the Communist Party of Vietnam, which has come up with one of the world's most effective pandemic containment strategies, as well as the Nordic social democracies of Norway, Denmark and Finland, characterised by very high levels of public spending and NHS-type healthcare systems, have been among the best performers in the developed world on both health and economic outcomes. So, he's not actually trying to put forward an answer. It's kind of the opposite. He's trying to say, no, you haven't got the answer, and this is why. He's trying to say that there was a lot more going on, and it's too easy to try and boil it down to one of the three main narratives being pushed, which are here. The one in particular about the NHS is number 3, the third false COVID-19 narrative from the paper, again to quote, the pandemic has driven home how lucky we are to have the National Health Service, and how grateful we have to be for that. The NHS has done the most amazing job under the most difficult of circumstances. It has held the nation together. Insofar as there have been problems, these are the result of political mismanagement, underfunding and outsourcing to private companies, not the NHS itself. He does go on to mention that he's not a fan of the whole adulation and clapping for the NHS. It seems a bit ridiculous. However, the effect that it has had is that the NHS has received the highest level of approval for any healthcare from any country, in that the residents think that they're getting a good deal. Not objectively, obviously not, but it is just controlling the narrative in order to push an agenda. So that's the point that he's making, just so we know. With that in mind, we can get back to what the response has been from our so-called leaders, our so-called representatives, that are supposed to have our best interests at heart instead of lining their own pockets and just doing clapback politics. So, they do try to quote him as well, but not so well. He does say that ones that have done well are for tigers of Asia. For example, of course, neighbouring countries, like Taiwan, that kind of knows what China is up to because they suffered through SARS before. So they're not going to trust the World Health Organization. And why would we, seeing as the World Health Organization investigators back Beijing's claim that COVID did not leak from a Wuhan lab and call for no further study into that theory? Oh, no. But they will probe China's claim virus was imported on frozen meat. Yes, because they've been bought out, so we know to not trust them, as Taiwan does, because of course they're the ones that have to deal with it. And having learned from the mistakes made with SARS, they've learned to move on from it. So good on them. And that's the kind of thing that we should be wary of as well. Not just trusting what other people say at face value, but using our own brains as well. And of course that is as true for individuals being wary of governmental institutions, as well as governmental institutions being wary of other governmental institutions. So yeah, be wary of number 10, but number 10 should be wary of China, and where it's dipped its fingers into as well. But I guess that's just too much to hope for. So of course, right, now that we know the kind of thing that Dr. Nimitz was talking about, Downing Street defended the Prime Minister's actions today. His press secretary, Allegra Stratton, told reporters, "You have heard him in his own words at the beginning of the pandemic. He was out every Thursday night clapping for carers because of the extraordinary efforts and exhausting work and job all of them have done to care for our families and loved ones. Unless, of course, they're busy making TikTok videos. Or leaving cancer unscreened. Or, of course, resulting in far more stillbirths. Or just ignoring old people because they're old, so then they're automatically at the back of the queue. Because you've got death panels in a socialist healthcare system. Yeah, other than that, very much so. Yeah. When they're understaffed and underpaid. Right, well, then that comes down to mismanagement. And of course, as we all know, the NHS would have gone under decades ago if it was a private run institution, if it was being run as it is as a governmental institution. But governmental institutions always find a tremendous way of wasting money. Because if they find a way to be more efficient, then they're not going to get paid as much. And what's the point of that? So no, they're going to get away with as much inefficiency as they can in order to have the lowest targets and the maximum income. To take it to a more extreme example, but just a reflection of human nature, you could of course use examples from the USSR, where, let's say, a farmer, for example, knew that if he was given a budget and generated a certain amount of corn, let's say, he would be expected to do that much next year, and maybe he wouldn't be given quite as many resources in order to do it, because he's outperforming his other chums, in which case, no, you don't need as many resources. Worst case scenario, if he does so well, then he's a gulag and sent off to the gulags. Okay, in which case, he's not going to want to do so well. In fact, he's going to want to do as little as possible, so it seems like more resources are needed there to make his life easier. And he doesn't have to produce as much or work as hard. Except, of course, if he doesn't work hard enough, then he's not a productive member of the commune, in which case, again, he's sent off to the gulag. So it's a balancing act there. So to make it more reasonable or rational, accessible, it would just be, if you are very efficient, you're going to have less funding, but if you're not efficient enough, you will get fired. But it isn't a competition in terms of free market, it's just emotional manipulation because it's government expenditure. And, of course, you're going to get a lot of support if you say, oh, but we need this, otherwise people will die. Yes, of course, it's just emotional manipulation on the political scale. That is it. So, to carry on, Allegra says, it's for think tanks to conclude whatever they deem right and an accurate reflection of the work that has been done. But of course it is something that he talks about every time he is in front of you all at press conferences. Yeah, fair enough, cool. And let's not forget that he himself has recovered from COVID and was treated in hospital when he was incredibly unwell, and he remains grateful to the people who nursed him then. As I'm sure everybody would be. Yes, if you've been nursed back to health, of course you're grateful for it. Of course, again, you could look at how other countries have handled it, and maybe world leaders who have been even older and yet recovered quicker using a different style of healthcare. If you wish to compare it, and I think that's the entire point here. Labour, of course, reacted with fury. Oh no, because there is a suggestion that because something is state-run, as in it's paid for by you, and if you refuse, you're carted off at gunpoint, and that's the only moral way, not allowing you to have a choice and decide for yourself. No. You are essentially a mushroom, kept in the dark and fed shit. So of course they're angry that their little pet project, started by the Conservatives, is being criticised, as Deputy Leader Angela Rayner demanded Health Secretary Matt Hancock return a donation of $32,000 he received from the IEA's chairman Neil Record. Yes, right. Oh dear. Because under their view, you can't have disagreements with a friend. No, you've got to be on the same page the whole way. Yeah. Which I think speaks volumes in and of itself. Or maybe, Angela, you're talking to somebody who has a different set of values to you. In which case, they don't really care about your sense of morality. Because they've actually got one. But she goes on to say, it is deeply concerning that the Health Secretary has such a close relationship with and is bankrolled by an organisation that wants to dismantle and privatise our NHS, and said that the idea that the NHS has done an amazing job during the COVID crisis is a false narrative, she said. Well, have you read the report? I know it's a bit lengthy and it can be difficult to read more than a tweet, but nonetheless, you could actually read it through and you figure out that that's not true at all. No, the point is, he's trying to dismantle arguments from both sides. One is that the NHS should be dismantled, and the other is that the NHS is great. He's even admitting his biases and saying we're not going to play to them. So yeah, he wants to dismantle the NHS because he's free market. He doesn't think that, your property should be stolen from you without your consent. Radical thought, I know. But that's not the point of the paper. Can we focus on the paper? Or not? Guess not. Character attacks all the way. To continue, if Matt Hancock is grateful to our NHS and the NHS heroes, everyone's a hero these days. And if everyone's special, then no one is, who have sacrificed so much during this crisis, he must demonstrate this by condemning this disgraceful report, distancing himself from the IEA, and paying back the donations he has received from the IEA chair Neil Record. So, no, I think it's pretty clear that she hasn't read the report and has no idea what she's talking about, which is hardly a surprise, but nonetheless, it's nice that she's just expressing that in her own words. So let's hope that Matt Hancock actually does read the report and then just refutes everything that she said, because he could. Or let's see if half-cock might grow the other half, and might grow some balls as well while he's at it. Off the soy, onto the red meat. And go right back at them. We can always hope, okay? We can always hope that some of the Conservatives we get will actually have a spine, instead of no character whatsoever. But also, just to put it out there, nobody that I've seen here is in any way trying to disparage the individual workers of the NHS. And they're not at all. It's trying to come back to the idea of management, for example, and how it's run. Not about the frontline workers, as they like to say. It's not about them. It's about the higher-ups and their poor decisions. And if you think that those frontline staff are not being compensated enough for the work that they're doing, then that's a pricing issue. And do you know the most effective way to get an accurate price? Yeah, that's free market. But do you know what would happen if we tried some free market medicine in the UK? Well, that's called the black market then, because it's got to be smeared. For example, how much is a COVID-19 vaccination worth? Well, how'd you find out? You'd have to buy from someone. Can you do that in the UK? You can. But it's illegal, and so it's called the black market. Even though it's the freer market. It's unconstrained. Because again, it's just all linguistics with them. If you've heard a term, especially if it's pushed by the left, do question as to what it actually means and where it comes from. and if you think it is an accurate reflection of what it is describing, or if it's just trying to push an agenda. I think you'd be amazed at just how often they're pushing an agenda, and you've just gone along with their assumptions and haven't challenged them. So do have a think. But last thing I will mention, is that it says, as well as attacking critics of austerity, the IEA also took aim at COVID-inspired protectionism on the right of politics. That's not protectionism. If you're talking about free market and being on the right, that's not protectionism, is it? No. Good. The paper criticised former Brexit Party MEP and ex-chairman of Southampton Football Club Rupert Lowe for saying only a fool could argue producing more food in our country is a bad idea, and also criticised Theresa May's former advisor Nick Timothy for saying something similar, that the pandemic may see the UK rue the lack of a national capability to produce what we need. The author added, the claim of this paper is not that the best performers did well because they have low public spending levels, that they did well because they have open economies, or that they did well because they have non-NHS type healthcare systems. And that's where we're going to wrap it up. If you want to read the full article, links in the description. By all means, go ahead. Spend some time in the evening. But otherwise, it's good to see what the response is when there's something that is a very approachable academic paper. It really is. It's written quite straightforward, easy to understand, written in simple language, and yet it's still a bit much for them, isn't it? And that's their job. And it's too much. Again, if you want to know how much something is worth, it's time for the free market. How does that work with the government? No wonder they don't want it. But that's it for me. So let me know what you guys think down below. As in what your take is actually of the NHS's performance. If you think, like, yeah, it's amazing and it's the best in the world, which I doubt you think. Or if you think, yes, it's definitely got its flaws, but the fact that it exists is more important than what it does, because it has more of a community building effect and it brings people together instead of actually being that good at what it is supposed to do. The indirect effects are better. Or if you think, no, it's not good at all, and we could really do with an alternative that we're not forced to go for, but of course we can only know about that once the current limitations are lifted. And the classic example of that is, no one knew how you were going to pick cotton if you free the slaves. Therefore, you can't free the slaves. So, no, we're going to find another way. And it's going to be more moral. As the author suggests, if we didn't have the NHS, we would have other healthcare. It's not NHS or nothing. But that's it from me. So as always, until next time, have a good one.